Right now, your heart is beating, steady, quiet. You can't feel it pushing blood through 60,000 miles of vessels inside your body. And that's exactly the problem, because something could be going terribly wrong inside those vessels. Right now, today, as you sit here watching this, and you would feel absolutely nothing. No pain, no warning, no alarm, just silence. Until the day it isn't silent anymore. I'm Dr. Henry Collin. I've been practicing medicine for over 20 years. I've held the hands of patients in emergency rooms. I've made phone calls that changed families forever. And I've spent the last 2 decades watching a single, common, completely manageable condition steal lives that did not have to be lost. High blood pressure. You've heard of it. You probably know someone who has it. You might even have it yourself. And there's a very good chance, a statistically significant, medically documented chance, that you don't fully understand what it's actually doing to your body. Because if you did, you wouldn't treat it the way most people do. And here's the part that keeps me up at night. Most doctors don't have the 20 minutes it takes to explain all of this to you. They check the number, they write a prescription, and you walk out with a little orange bottle and a vague sense that everything's been handled. But it hasn't. Because the medication is only one piece of a much bigger, much more urgent story. Today, I'm telling you the whole story. Everything. The parts that get skipped in a rushed clinic visit. The myths that are genuinely dangerous. The signs that people miss until it's too late. And the things you can start doing, some of them today, that can change the entire trajectory of your cardiovascular health. Stay with me all the way to the end. Because there's a twist in this story that most people, even people who've had high blood pressure for years, have never heard. And it could be the most important thing you learn all year. Let's start with the number. You sit down in the doctor's office, the cuff goes on your arm, it squeezes, it releases, and then the nurse says something like 140/90, and you think, okay, that sounds a little high. The doctor says, we should watch that. You nod, you leave. And then life happens and you forget about it until next year's appointment. That moment, that forgettable, routine, totally unremarkable moment, is where the damage begins. Because here's what nobody explains in plain language. Blood pressure isn't just a number. It's a measurement of force. The force your blood is exerting against the walls of your arteries with every single heartbeat. And when that force is consistently too high, it doesn't just sit there harmlessly waiting for you to deal with it. It works. Every hour of every day, it is physically damaging the interior walls of your blood vessels, tearing tiny microscopic injuries into the lining of your arteries. And your body, in its brilliant, desperate attempt to heal those injuries, sends repair materials, cholesterol, calcium, inflammatory cells, to patch those tears. That patching process is what builds plaque. That plaque is what narrows your arteries. That narrowing is what leads to heart attacks and strokes. And all of it, every step of that destruction, is completely silent. That is why we call high blood pressure the silent killer. Not because it's dramatic, because it isn't, because it is the most undramatic, unassuming, quietly devastating process happening inside millions of people right now who believe they feel perfectly fine. And feeling fine, I need you to hear this clearly, is not the same as being fine. Now let me talk about something that genuinely frustrates me as a physician. The threshold myth. For decades, the medical community told patients that 140/90 was the line. Below that, you're okay. Above it, problem. And that binary thinking created a false sense of security for an enormous number of people. Because research, large-scale, rigorous, peer-reviewed research, has shown us that damage to blood vessels begins well before you cross that old threshold. Blood pressure consistently sitting at 130/80? That's already a conversation worth having. 125/82 in a younger person with other risk factors? That deserves attention. The line was never as clean as we made it sound, and millions of people spent years sitting just below the danger zone, believing they were safe, while their arteries were quietly accumulating damage. Some of those people eventually walked into my emergency room. Some of them didn't walk in at all. But here's where the story gets more complicated, and this is the part most people have never been told. High blood pressure doesn't just attack your heart, it attacks everything. Let me take you through what's actually happening in your body when your pressure stays elevated over months and years. Because once you see the full picture, you will never dismiss a high blood pressure reading again. Your brain. Chronically elevated blood pressure is one of the most powerful predictors of cognitive decline and dementia. The same mechanism that damages coronary arteries damages the tiny, delicate blood vessels inside your brain. Small vessel disease in the brain leads to what physicians call white matter changes, essentially microscopic areas where blood flow has been compromised and brain tissue has been quietly injured. People with long-standing uncontrolled high blood pressure are significantly more likely to develop vascular dementia. The memory loss, the confusion, the personality changes that families often attribute to just getting older. Sometimes it started in the blood vessels years before. Your kidneys. Remember what I said in our last video about kidney disease? Here's the connection. Your kidneys filter your blood. They are extraordinarily sensitive to blood pressure. Chronically elevated pressure damages the nephrons, the tiny filtering units inside the kidney, over time. And damaged kidneys, in turn, raise blood pressure further. Again, that vicious cycle. Hypertension is the second leading cause of kidney failure worldwide. And most people who end up on dialysis never imagined years earlier that their blood pressure was quietly sealing that fate. Your eyes. There are blood vessels inside your retina, the light-sensitive tissue at the back of your eye, that are incredibly fine and fragile. High blood pressure can cause those vessels to thicken, narrow, or rupture. This is called hypertensive retinopathy, and in severe cases it leads to vision loss. Your eyes are actually one of the few places where a doctor can directly observe the effects of high blood pressure without any invasive testing. When I look into someone's eyes with an ophthalmoscope and I see changes in those retinal vessels, it tells me something important about what's been happening in the rest of their vascular system. Your heart itself. Beyond heart attacks, sustained high blood pressure forces your heart to work harder with every single beat. And just like any muscle that works too hard for too long, the heart responds by getting bigger. The left ventricle, the main pumping chamber, thickens. It becomes less flexible, less efficient. This condition is called left ventricular hypertrophy, and it's a serious independent risk factor for heart failure, arrhythmias, and sudden cardiac death. Your heart is literally being remodeled by the pressure you're ignoring. Now, I promised you a twist, and here it is. Are you ready? The most dangerous form of high blood pressure is not the kind that shows up at your doctor's office. Let me say that again because I need it to land. The most dangerous form of high blood pressure, the one that predicts the worst outcomes, is the kind that hides. It's called masked hypertension. A person's blood pressure reads normal in the clinic. The doctor says, "Great, looking good." The patient leaves relieved. But at home, during stress, during physical activity, during sleep, their blood pressure spikes, repeatedly, dangerously. And because it never gets captured in that clinical setting, it never gets treated. Studies suggest that masked hypertension may affect up to 1 in 8 people who appear to have normal blood pressure. 1 in 8. This is why home blood pressure monitoring is not optional for anyone with cardiovascular risk factors. It is essential. A good quality upper arm blood pressure monitor, not a wrist device, upper arm, used consistently in the morning and evening, will tell you the truth about your blood pressure in a way that one annual clinic reading never can. Bring that log to your doctor. Insist they look at it. It could change your entire treatment picture. Now let me flip this, because there's another side of this story. White coat hypertension. Blood pressure that spikes specifically in medical settings due to anxiety or stress, but is normal everywhere else. This is real, it's common, and it leads to overtreatment in some patients. It's why clinical context matters. It's why I always ask patients, what does your pressure look like at home? It's why a single elevated reading should never be the sole basis for a major medication decision. The point is this: blood pressure management is not a once-a-year snapshot. It's an ongoing, dynamic picture, and you deserve to be an active, informed participant in reading that picture, not a passive recipient of whatever number gets jotted in your chart. Let's talk about myths, because there are several that I encounter constantly, and they are genuinely putting people in danger. Myth number 1. I feel fine, so my blood pressure must be okay. We already dismantled this one, but let me reinforce it with something concrete. One of the most physically fit-looking patients I ever treated, a 44-year-old man who ran marathons, ate well, slept 8 hours a night, came to me for a routine sports physical. His blood pressure was 168/104. He had no symptoms whatsoever. His arteries were already showing early signs of stiffening. He had no idea. Feeling good is not a blood pressure monitor. Stop using it as one. Myth number 2. High blood pressure is just a natural part of getting older. No. I want to be very direct about this. While blood pressure does tend to rise with age due to arterial stiffening, that tendency is dramatically influenced by lifestyle, diet, stress, sleep, and body composition. There are populations in the world, communities eating whole foods, moving regularly, sleeping deeply, living with low chronic stress, where age-related hypertension is virtually absent. Aging increases risk. Aging does not make high blood pressure inevitable or acceptable. Myth number 3. Once I'm on medication, it's handled. This one worries me more than almost any other. Medication is a tool, an important one, a life-saving one for many people, but it does not undo the lifestyle factors driving the disease. A person taking antihypertensive medication who continues eating a high-sodium diet, sleeping poorly, carrying excess abdominal weight, and living under unmanaged chronic stress, that person is still losing ground. The medication is fighting a battle that lifestyle is actively making harder. Medication and lifestyle change work together. Neither one alone is the complete answer for most people. So what actually moves the needle? What does the evidence say about non-medication approaches to blood pressure? Let me give you the real clinical picture here. Sodium reduction. The relationship between dietary sodium and blood pressure is one of the most well-established in all of cardiovascular medicine. Most people consume far more sodium than they realize, not because they're salting their food heavily at the table, but because of processed foods, restaurant meals, bread, canned goods, deli meats. These are the hidden sodium bombs. Reducing sodium intake can lower systolic blood pressure by anywhere from 5 to 10 points in salt-sensitive individuals. That is clinically significant. That is medication-level impact from a dietary change. Potassium. Here's the flip side that almost never gets mentioned. Potassium counteracts sodium's effect on blood pressure. It helps your kidneys excrete more sodium. It relaxes the walls of blood vessels. Bananas get all the fame, but leafy greens, sweet potatoes, beans, avocados, these are potassium powerhouses that belong on every hypertensive patient's plate. The ratio of sodium to potassium in your diet may matter as much as either one alone. Physical activity. Aerobic exercise, walking briskly, cycling, swimming, dancing, performed consistently reduces blood pressure through multiple mechanisms. It improves arterial flexibility. It strengthens the heart. It reduces the hormonal stress response. Studies consistently show that regular moderate aerobic exercise can reduce systolic blood pressure by 5 to 8 points on average. Not a dramatic number perhaps, but sustained over years, that difference is the gap between a stroke and a birthday. Sleep. This one is criminally underappreciated in blood pressure management. During deep restorative sleep, your blood pressure dips. This is called nocturnal dipping, and it's protective. People who don't experience this dip, because of sleep apnea, insomnia, or chronically short sleep, have significantly elevated cardiovascular risk. If you snore heavily, if you wake unrefreshed, if your partner tells you that you stop breathing at night, please get evaluated for obstructive sleep apnea. Treating it can dramatically improve blood pressure control in ways that medications alone cannot match. Stress physiology. Chronic psychological stress activates your sympathetic nervous system, your fight-or-flight response, which raises heart rate, constricts blood vessels, and elevates blood pressure. Repeatedly, chronically. Managing stress is not a luxury, it is cardiovascular medicine. Meditation, deep breathing, time in nature, meaningful social connection, reducing chronic overcommitment. These are not soft suggestions. They are evidence-based interventions with measurable effects on blood pressure and long-term cardiovascular risk. Here is what I want you to take from this video. The one thing, if you forget everything else. High blood pressure is not a life sentence. It is not something that simply happens to you and then controls you. It is a signal. A signal from your cardiovascular system that the current conditions inside your body are unsustainable. And signals can be responded to. Conditions can be changed. Trajectories can be altered. I have watched patients reverse early hypertension completely through committed lifestyle change. I have watched others dramatically reduce their medication needs, sometimes eliminate them entirely under medical supervision, by addressing the root causes rather than only managing the symptoms. I have watched people in their 50s and 60s fundamentally transform their cardiovascular risk profile. The body has a remarkable capacity to heal when you give it the right conditions. But none of that happens without awareness. None of it happens when you dismiss the number on the cuff because you feel fine. None of it happens when you hand the problem entirely to a medication and consider it solved. You have more power over your blood pressure than you've probably been led to believe. And now you have more knowledge than most people walking out of their doctor's office today. Use it. Get a home blood pressure monitor if you don't have one. Start logging. Have a real conversation with your physician, not a 3-minute check-in, a real conversation about your numbers, your risks, your options, and your goals. Ask about your sodium intake, your sleep quality, your stress levels. Bring your lifestyle into the clinical picture, because it belongs there. And if this video gave you something today, a new piece of understanding, a moment of recognition, a reason to finally make that appointment you've been putting off, then please share it. Send it to someone you love, because high blood pressure is not picky. It doesn't care how young you are, how healthy you look, or how good you feel. But knowledge does care. Knowledge changes outcomes, and that is exactly why I'm here. Subscribe to this channel, because next time, we're going to go even deeper, into the foods that are silently raising your blood pressure every single day, and the ones that are protecting your arteries in ways that will genuinely surprise you. I'll see you there.